All right. Hello, everyone. Welcome to the American Canadian School of Medicine. Today, we're going to be talking about our involvement in community medicine and community outreach in Dominica. So first of all, I want to introduce myself. My name is Maria Mancia. I am the national recruiter as well as admission advisor here for ACSOM. This is my telephone number and this is my email. I want to make sure that everyone is able to reach out to me with any question whatsoever. If you need suggestions, if you need a little bit of guidance, whether you're ready to apply or not, please feel free to contact me at any point. We also welcome you to drop in the comments section any questions that you have along the way. And if you want to let us know where in the world you are, please go ahead and do so. I myself am in Chicago, and we're going to meet some amazing faculty and leadership from American Canadian School of Medicine. And they're going to give us a little bit of background on who they are and how they got to this juncture. We're going to start with the president of ACSOM, Mr. Kerry M. James. Hello, Kerry. Thank you for joining us today.
Thank you for having me on today's webinar, Maria. I'm happy to be here.
And if you could start by giving us a little bit about your background, that would be fabulous.
Sure. So I now have an over 20-year relationship with Dominica. Some years ago, I actually worked with one of the previous medical schools in Dominica, actually for about 16 years, and I finished as their head of operations, and was certainly very involved in not just the university, but how the university impacted the people of Dominica. And outreach is so important. It's been part of how I've operated for the last 2 decades. It's not just about producing the best physicians, which is certainly the number one goal, but we also have a social mission as well now with American Canadian School of Medicine, and that's something that I'm going to be focusing on here in our discussion. I'm going to share with you my direct contact information, so you can email me directly just at kerry@axom.edu.dm. This is my direct cell phone should you have any questions, and I always encourage our students, our faculty, our staff. It's always an open door policy, and even if I'm in a meeting, I'll make time that same day to meet with people, and it should be no different for our prospective students and our new students that are coming in. As I understand, there's a number on our webinar today. Today we're really going to talk about 2 things. I don't want to go through too many slides here, but really we're just going to talk about the overview of American Canadian School of Medicine, what our mission is, and then specifically we're going to be talking about community medicine and outreach in Dominica, because it's not just part of our education, but it's also part of our mission. As you may know, and this is actually our beautiful 30-acre, $100 million campus, about 160,000 square feet of medical school. We're actually in a public-private partnership with the government of Dominica, where the Ministry of Health not only has been licensing our physician faculty. We'll talk about our small groups, but they're all physician-led by practicing physicians. And we train the physicians. It's not just enough that they've been wonderful in the hospital saving lives and seeing patients, but they're trained to be great educators, and specifically small group educators. This is a big campus, but our classes are small. You won't have any more than 10 students in your learning team. All your the things you need to get through medical school are on our Canvas, our LMS. But really, it's all about the days that you spend with our physicians on campus. One of the things that we were really founded with in mind is that of all the people that take the MCAT each year, about 70% score well enough to be qualified to go to medical school. The AAMC will tell you that about 75%, the top 3/4 of those that take the MCAT, all have what it takes to make it through medical school. And actually, many of those who don't score in those top 3 quartiles also, under special circumstances, excellent academic performance, can also do very well in medical school. The problem is that while the vast majority of medical school hopefuls are qualified, only half are going to secure a seat in either a U.S. or Canadian MD program or USDO program. There simply just aren't enough seats for the number of qualified applicants. Next slide there, Maria. And what I can tell you is that, and I'll bring you here to introduce you to Stan White. I just give you a little bit of a background about us is that we're a nonprofit medical school. What does that mean? It means that we charge a lot less because we don't have to charge more to make profit. And so our total tuition is about $214,000 when you look at the entire 4 years of medical school, and that's before scholarships. So far, 100% of our students have received scholarships. Again, our focus is on education. It's physician first training there on campus. And I can tell you that our social mission is one to improve healthcare in Dominica. Our academic mission is to produce the best physicians and to take your opportunity here for medical school and make you the best physician that you can be. That's our educational mission, is to improve healthcare in Dominica. And so we're going to talk about community medicine today. We're going to talk about what our students are doing on campus and off campus to help the people of Dominica. And I think it's just a brilliant way to learn, but it's also a great way to live as a physician in training that we excel at what we do in the classroom, but I think we're also training our students really in terms of social mission. And I think the expectations of physicians in society and communities, and that's really what today's discussion is about. I'm going to introduce you to Dr. Stan White. He's our Senior Associate Dean for Student Affairs and our Campus Dean as well. Dr. White's been previously the Dean of Medical Schools. He's been the head of campuses before for medical schools. He's been the head of their tutoring centers. He has a long and distinguished academic career, primarily from the United Kingdom at Manchester and Leeds. He was also had appointments at Yale at different times. And, really just a tremendous honor to work with Dr. White. So I'll let Dr. White tell you about what's happening on campus. And then we're going to move on to Dr. Wiley, who will tell us what we're doing to execute on our social mission and our social contract, really, with the people of Dominica. Thank you.
All right. And Dr. White, if you are there, you can please join us. Okay. So I think we have dropped Dr. White there, some technical issues. So we are going to come back to him. I'm going to go ahead and Carrie, would you like to review some of the information Dr. White was going to? Oh, there he is. Never mind. Welcome back, Dr. White. Perfect timing.
Carrie and everyone, my internet just dropped transiently, I hope. I don't know what Carrie had said about me, but
all good things. All good things.
I'm sure. So, like Carrie, I have a long experience in Caribbean medical education. In fact, in medical education as a whole, I have over 30 years experience, both as a teaching faculty member and as an administrator and leader. I actually began studying to be a doctor, but decided to take a different pathway and become a medical researcher, an educator. And I continued on that pathway through several major universities in both the UK and the United States. But I've been living and working in Dominica now since 2010, working for most of that period with the same university that Mr. James was working with before it left Dominica. So I joined ACSOM last year with the incoming class. And what attracted me to join ACSOM, as Mr. James has mentioned, is the really unique mission and vision that this school has. We took an approach to our education which is rather different to what you might experience in most other big medical schools. We moved away from large class, content-driven didactic delivery to using small classes where a small number of students, 8 to 10 usually on a daily basis, are in contact with physician faculty in small classes, dealing with information which they've researched themselves in advance under direction of those faculty. And then in these small group sessions, work around clinical problems. And that starts really on day one of the curriculum. The curriculum has been designed exclusively by physicians and is delivered by physicians. And the early clinical exposure that we provide both in the classroom and outside the classroom, we think is the most important feature of our educational process. Now, interweaved within our curriculum is our social mission, and it's my great pleasure and privilege to be involved in the development of the social mission for ACSOM, and you're going to hear a lot more about our social mission and how it's interweaving with our curriculum from Dr. Wiley in a couple of minutes. I just want to talk about our accreditation, because obviously if you want to go to a medical school, you want to become a practicing physician. ACSOM is fully accredited by the IAAR through to 2028. That is the Independent Agency for Accreditation and Rating. And we have preliminary accreditation from the Accreditation Commission on Colleges of Medicine, ACCM. Now, the important point is that both of those accrediting agencies are recognized by the World Federation of Medical Education, or WFME. So if you navigate on the internet to the World Directory of Medical Schools, you'll see that we are listed there as a functioning medical school. You'll also see that with our accreditation, we have an ECFMG sponsor note. And that's critical for a medical school to be able to offer students, in the sense that it means that our accreditation has been judged adequate so that our students and our graduates will be able to take the USMLE Step 1 examinations and participate in the National Residency Match, NRMP, in the US, and the equivalent in Canada. Now, all of this goes on in the island of Dominica, which is where I've had the privilege to call my home for the past 14 years. It's a small, beautiful island, regularly rated one of the most beautiful locations in the world. It's a small population of about 70,000 people. It has a very mountainous topography, full of rivers. We have 365 rivers, waterfalls, lakes. It is an island that really cries out for anyone with a spirit of adventure to explore, and it has a thriving eco-tourist industry. So there are lots of activities that are available to do: mountain walking, trail walking in the rainforest, sailing. It has some of the best scuba waters in the world. It's a UNESCO World Sanctuary Site for whale watching. Anything you want to do which involves an outdoor location is something that Dominica can offer. But importantly, as a student, it's also a very homely, welcoming, peaceful island. Its crime rate is very low, so you can walk around Dominica with really no real fear of the same sort of things happening to you that might happen in certain cities in the US. Our security team on campus guarantees safety on campus 24 hours a day, as well as in the areas of around Picard, which is where the campus is situated, where students are living. And any students who come to us live in apartments. Our student services department work with you to find an apartment and place you in the best apartment to suit your needs. And all of those apartments are within 5-6 minutes walk of the campus. So the university is a thriving community within a very peaceful location. Now, as Kerry mentioned, our non-profit status and our partnership with the government has allowed us to enter into a whole series of outreach and social mission activities, health fairs in the community, and a whole load of other things, which I'm now going to hand over to Dr. Wiley to tell you about. Dr. Wiley is one of our senior advisors to the Dean. She's an associate professor at the Schulich Interfaculty Program in Public Health. Now, Dr. Wiley is one of a number of visiting faculty that come to the island on a regular basis. All of our visiting faculty are drawn from top flight universities in both the US and in Canada, and they add an important feature to our curriculum by interacting in our small groups with our students and with our own permanent faculty on campus. Dr. Wiley is a specialist in implementing equity and diversity and inclusion in health professional education. And so I'd like to hand over to her now to tell you more in detail about our social mission and our outreach activities. Dr. Wiley.
Great. Thank you very much, Dr. White. So I'll just say a little bit more about myself. So I am an associate professor at Western University in Canada. So I'm coming to you from just outside Toronto right now. So we don't have the storm that Dr. James has right now. So hopefully we're good for that. So I'll just tell you a little bit about what brought me to Dominica at first. So I actually have a family member who lives there. My sister-in-law has been living on the island for over 30 years. And as a researcher, I'm always naturally curious whenever I go to other places. And Indigenous health is one of my main areas of research. And as you may be aware, Dominica has an Indigenous community, the Kalinago peoples. And so when I visited the island, I met with healthcare providers from the community, with the chief of the Kalinago territory, Lorenzo Sanford, and just try to get a sense of what's the Indigenous people's experiences on the island. And surprisingly, there's a lot of similarities to what I see in Canada. And so I had done that work, made some of those connections. And then as Dr. White had said, it's a very small island. So as you're walking down the street, I ran into one of the members of the staff of the university at ACSOM, who used to be at Ross University, who knew the school was going to start up again. And he connected me to the dean, not Dr. White, but Ramin Ahmadi. And I had a chance to talk with him. And what really made me committed to working with the folks in Dominica is that nonprofit status and commitment to social accountability that we don't always see happening in the medical schools. And that's a lot of the work that I'm doing here in Canada. So I work with, teaching the CanMeds. So it's the competencies for medical education, particularly focusing on equity, diversity, and inclusion and community health. So just to tell you a little bit about what we're trying to do in community education and public health practices here in Dominica. So one of the things we are trying to focus on is, as Mr. James said, to increase the population's health in the island of Dominica and have better health outcomes. And so we're getting involved in health education, so bringing the best evidence in current health practices and to the community through community events we'll talk a little bit more about, and also looking at how we can improve public health policies to address the types of health issues that people face in Dominica. That also has us working on prevention, diagnosis, and treatment of health issues at the community level. So we'll talk a little bit more about how we work in the community to make sure that our students and faculty and staff are supporting the health of the population through engagement with the people of Dominica, just regular people, as well as the other organizations that are serving those community health interests. The other thing we look at is how do we actually target the specific communities? So as I said, we've been doing some work with the Kalinago community. People may be aware that the new president of Dominica is a Kalinago woman. And so last time I was there, I met with her to get a sense of what are some of the priorities of the community on the island. And it was things like food security, climate change, aging, healthy aging. So one of the things that wasn't said about Dominica is it's actually one of the blue zones in the world. So the older generation, there's a number of people who live to be over 100. They're very healthy practices on the island. But then we see challenges of the younger generation where people are getting cancer much younger. There's, things like that happening. So looking at what are some of those issues that we can, share the responsibility to improve the health and health outcomes through that work. So our approach to community medicine is really to have it integrated into the curriculum to ensure that students understand the experience. So that means bringing hands-on experiential opportunities for our students to bring the knowledge they learn in the classroom around health practices, the determinants of health, particularly focusing on the social determinants of health and how we can make an impact on that through interventions in policy, education, and practice. And for us, it's also around educating our health professionals and our doctors to be strong advocates to address community health. So we really have offer this global health experience addressing, the sustainable development goals that I'm sure all of you are familiar with. So the experience in Dominica is one that is going to allow you to transfer to that knowledge to any other places where we have disenfranchised populations, which of course is everywhere around the world. But those of you who are, wanting to come from the U.S., lots of issues that would be facing folks in the United States as well. So we're really trying to get our students to understand how to work in the community. So how do we actually bring our knowledge in ways that are understandable, be approachable to the community, and find out from the community what's going to work in their context, because we don't always understand how people make their choices around health and what resources they have access to. So part of our work is having our students develop empathy and a commitment to that societal health improvement through engagement with the population, as well as leaders, whether that's the political leaders as well as organizational leaders, such as the, say, Roy Asta Foundation, which are folks looking at stroke awareness and prevention in Dominica, to help students appreciate the impact that their work can have on addressing those social determinants of health. So our approach to programs is really, as I said, that community health improvement. So one of the things we do is provide healthcare access to underserved communities. So that's through health fairs that we've done. So Diabetes Day, for World Diabetes Day, our students were engaged with a health fair where we brought educational pamphlets around best practices in diabetes management, and as well as we did screening for blood sugar, blood pressure testing, those types of things, and then got people engaged with thinking about how could they improve their health after we did some surveys with them around some of the experiences that they're having in their lives. So one of the things our students found was that the community was very generous with their time and sharing back to help us understand better how we can support those community health goals. So once again, some of those key initiatives was the mobile health clinics. So one of the things that my role is at the school is to make sure that we're taking the learning from the classroom out into the community. So I will just see if these actually show. I think we have these on our websites, but our students developed a series of pamphlets looking at what are some of the health issues. So what we did in the classroom was have students do research on what are some of the best practices for disease prevention, health promotion, and then take those learnings. So they were finding research articles to then develop knowledge translation strategies for how do we actually bring this to the community. So that was through creating these posters and pamphlets, sitting with people and talking. So we actually had our students do a survey at one of our last community health days. And those are some pictures from that day here on the slide, where we asked people around, what are some of their practices around healthy lifestyles? So are people getting enough sleep? How are people addressing their stress? How much stress do they have in their lives? What's their access to healthy foods? Are they getting enough exercise? And how can we support that social connectedness? And as others have said, I think social connection is one of the things that Dominica actually does very well. And I think that's one of the reasons why we have people living so long. It's a very vibrant culture. And I actually find after I come home from Dominica, I feel a bit lonely in Toronto, the city of 9 million people, because when you walk around Dominica, everyone says hi. So through this work, we do the partnership with local communities. And, the benefits from our students are gaining this valuable experience through engagement with the local community. So for the Diabetes Day, we partnered with Jolly's Pharmacy, which is a pharmacy that's on the island. They have a background in, I think it's a doctor of pharmaceutical sciences who runs that program, that runs the pharmacy. And they have quite a social mission as well. So we worked with them to have that Diabetes Day. The students got hands-on experience of doing, that screening. So we had them working alongside the nurses from Portsmouth Health Unit, which is the area where our school is located on the island. They got to understand those health needs of the populations. One of the things we saw and our students kind of reflected on was, as we had that health fair at Jolly's Pharmacy, all of the women were coming forward and men were standing around at the back watching what's going on. Do I want to be involved? Check out. And so as you see our student Vincent there, I think he went around and talked to people in the back saying, come on in, this is for you as well. And it was a way to think about how do we engage people who maybe aren't as comfortable to do that work. one of the things I really focus on in community learning is that it isn't just about like a nice community project and social engagement, but also competency and skill development. So I embed those practices that we have in our community engagement, like I said, in the CanMed's competencies, particularly around communication, partnership, and leadership and advocacy. And so the students think about how do we actually embed those competencies in their medical learning so that they will be good community doctors in the future. So they develop good clinical and communication skills, problem solving skills, because a lot of the folks that they talked to had complex issues that needed to be addressed, and our students were working with them and then connecting the population to our physicians who are the faculty at the university to see how we could support them. And at the same time, it's preparing them for future careers. As I said, it's a global health experience in Dominica. Our students get a chance of understanding what are some of those issues that disenfranchised populations are facing every day, and how can they help address bigger policy and population level questions to advance health, and then an opportunity to network with experienced professionals and mentors in the field. So as I said, we had members of the Ministry of Health join us for that day, also local doctors in the community of Dominica who know the island and who are trusted by the island. And then for Diabetes Day, we were also working with diabetes educators on the island. So it's a real good chance for our students to learn from the community and then help support those community health goals.
Great. Well, thank you so much, Dr. Wiley. The work that you do is incredibly important and it's so exciting. So we really appreciate your time here tonight. I want to go ahead and just remind everybody to drop in any questions you have. We will be having a Q&A section towards the end. So, get those questions ready, get them queued up. I see some people who have already applied. So thank you, Melissa and Hi. It's nice to connect with you. And if you are just joining us for the very first time and learning about us first, welcome to you. Again, my name is Maria. I am an admissions advisor and national recruiter. I'm going to drop my telephone number and email in the chat in a little bit, and I invite you all to contact me with any questions that you may have. So I do want to talk a little bit about the admissions process. Again, I'm thrilled for the opportunity to connect with you. It's always very exciting for me to speak with people who are potentially looking to apply. They may be hesitant. There's a lot of questions, right, that go on in making these decisions. But at ACSOM, we are dedicated to talking to individuals who not only meet our academic requirements, but demonstrate the potential to thrive and that passion that is necessary to be successful in the medical field. So as far as the admissions process, I'm going to go over the requirements with you. Again, if you have any questions, if your situation is a little bit different, please let me know. We can always talk to you about your particulars. So we do require a bachelor's degree or higher. If you're in Canada, if you're in a different country, it would be the equivalent to a bachelor's degree. So again, if you have questions about that, just let me know. So within the bachelor's degree, the major isn't as important as having taken the prerequisites. So that would be 2 semesters of biology, 2 semesters of chemistry, 1 semester of organic chemistry, a semester of math or biostatistics, physics as well. And again, if you have questions about whether the classes you have taken are equivalent or if they can be taken in lieu of these, just reach out. We'll be more than happy to assess your transcripts, and we'll be able to determine that along with you. So in addition to the transcripts, we also require your resume, a most updated resume. If you haven't had a job, perhaps you have done some volunteer work, you've done some shadowing, internships, anything like that that tells us about your experience. That's what we want to know. To go into further detail, we also require a personal statement. And that's very important also because it lets us know in your own words about your background, your experience, who you are, your goals, So that is something that, shouldn't be too long, but you should place a lot of emphasis and attention to. So that's your personal statement. We also require 2 letters of recommendation. So any professor, anybody in your academic background that can speak to who you were as a student, that would be excellent. If you have a professional letter of recommendation, again, if you've shadowed or interned, we would be happy to take those as well. So MCAT is required for the MD program. Obviously, it's a critical component of your application. If you have questions about your particular score, let us know. If you haven't taken it yet, you will be required to take it. However, we do have a prep program, Prep for Success, and this is a decelerated program that we're offering. It is 1 semester long on campus. So you will be with the students, you will be taking classes with the professors there, living in the apartments on the island. You'll basically be integrated into the program itself, but it's decelerated. So for that 1 semester, you're going to be taking foundational classes at a slower rate so that you have that necessary foundation and understanding of the sciences when you do begin the MD program. If you have questions about that in particular, please let me know. For that program, the MCAT is not required. And at the successful completion of the prep program, you do not have to take the MCAT at all. So it is in lieu of the MCAT. So it's a great opportunity for those that, maybe you get test anxiety. Maybe you have already taken the MCAT and it is not your best representation of your capabilities as a student. So, please reach out to us. We do have those 2 different opportunities for you, whether it's directly to the MD program or MD first prep. So let us know. But remember, the journey to becoming a physician is challenging. We are here to make this a little easier, at least the process of applying. We're here to help you answer any questions. No question is too basic. Please let us know. Every individual has their own background and their own experience. So we do believe in you. We want to watch you succeed. We want to be there when you graduate. Do not hesitate to reach out to me. President James Carey as well has given you his telephone number. And how many schools do you know where the president is giving you their personal cell phone and email address, right? So everybody here cares about your success. Please drop any questions that you have, and what is the best way to reach out with additional questions? So let me go ahead. I'm actually going to drop my telephone number right now. You can text me, you can call me in a little bit. I will drop my email address as well if that's a preferred method for you to reach out. The final step for the application process is the interview, and that will be done with the interview committee. It's typically about an hour long. You can't really prepare for it. You can be on time, you can be early, you can dress professionally and be in a setting where it is quiet, you're able to concentrate and focus and present your best self forward. So we do accept the AMCAS, the ACOMAs. If you're in Texas, there's also an application there. If you're in Ontario, there's an application there that we would accept, or you can just go directly to our website, and we're going to drop that link in a moment for you to have direct access to. But you can go to our website and apply directly. There is no fee for the application, so I do invite you to, if you are ready, apply tonight, apply right after this webinar, drop me a text and let me know, hey, Maria, I applied. So I can reach out to you and congratulate you, and always be available along the way if you have any questions, or even if your family has questions. We're always available here to help. So having said that, I do want to go ahead and give you the QR code directly to the application. Again, that first step is, daunting, but it is the most important step you may take in your life. So let us help you along the way. We're more than happy to do so. So we're going to talk a little bit more about ACSOM and if it is the right choice for you. This is the point where we answer any specific questions you might have. So please do not hesitate to drop any additional questions there. If not, I'm going to invite President Carey James back on, and Dr. Wiley and Dr. Stanley White to be available, and also just impart any additional knowledge that you would like to, at this point in the webinar.
Great.
So I don't see any questions, so I'm going to pass it over to President James. Any additional words you would like to say?
No, I wanted to thank Dr. Wiley for that great overview in terms of our community medicine involvement. And I was going to ask you if maybe you wanted to share some of the student feedback that you've received. It's I know that students are always filling out their evaluations, really even weekly, looking at the different experiences that they have during medical school. We like collecting this information. It really helps us guide the student experience and see where we're excelling. But I've heard many good things about this. Some students have said it's the best part of their experience so far in Dominica. I've seen students that have shown up kind of where am I and getting to know this beautiful island. But this has been such a big part of them branching out from the confines of campus and really getting a pulse for the community. And it's it's making it much more than just our schoolwork. So if maybe you could share some of the feedback or what our students have said are most impactful about the community medicine work that we do.
Sure. Yeah. I mean, one thing I'll say is when we started suggesting we're going to go out and do community health fairs, the students are feeling a little overwhelmed with how much work they have on hand, and we're, a little apprehensive about doing this work. So we really tried to make sure it was tied in with the content that they were doing in class, so they could feel like, they were bringing that expertise to the community work. When we did the first Diabetes Day, I think one of the things the students were quite surprised is how good they actually were at doing research and be able to do that knowledge translation. So, I had them go off and find 10 articles in the different areas related to diabetes care. So like retinopathy, wound care, diet, exercise, all of those types of things. And they came up with really good pamphlets with high level information that were printed out. And they said it was, really valuable to be able to share that experience with the community. They loved the day. And then when they went down into the capital to do their grocery shopping later in the week, they saw their pamphlets in the pharmacy down in Roseau in the capital. And they were like, oh, our work is getting out there around the island. One of the things I'd say, too, is, Kerry can speak a little bit more about his experience with Ross, or the folks who were at Ross University before, is the community kind of expects us to go out there, right? Because Ross had spent over 30 years engaging the community in these health fairs. So every time people see our students and know the folks from our school, they're like, oh, great, when are you guys coming next? Because we always love those events when we had the students come out. For the more recent one that we did at the market, so as people may be aware, there's a vegetable market and fish market downtown. We went early in the morning to engage people who are coming shopping, and that's when we did the survey asking about people what health issues were. And one of the things our students found is that the communities really shared a lot of valuable information with them. So our students had great conversations, and they really felt like they were part of the community when they were able to get that information so freely. And then community members hung around and stayed with us all that time. So afterwards, I spoke to them. They're like, oh, now we understand what you're trying to do here with this course. So they thought I was just kind of adding a bunch of, busy work to their schedule. And after they did that, as you said, Kerry, they felt like that was some of the most impactful learning they had, to realize okay, people actually have some real issues that they want to share with us that can help guide our understanding of how we do community health work.
And it's become such a major part of education. I know in North America now, some people call it zip code medicine, but the social determinants of health. But unless you understand people's daily lives and how they're living and the challenges they face, you're really just thinking in the context of where you see them in a doctor's office or in the hospital, and not about the years of prevention and management. And it's just such I think an absolute requirement now for training a modern physician. And just really thank you for spearheading this. It's making our students better. So.
Oh, definitely. Because one of the things I see, and this is also drawn on my sort of 13 years of doing community engaged learning in Ontario, is that sometimes when we're learning from cases in textbooks, we expect the real world to look like that. And it doesn't, right? So I think this is the one thing that's really valuable, is the students get out there and wait, you've got diabetes and mental health issues, and now you're facing a cancer diagnosis. I never had a case like that where there were complexities, added on top of each other. So that's a real great opportunity our students have to see that, actually things in the real world are a lot messier than our textbooks ever presented, and it helps prepare them for when they actually meet patients with those complex experiences.
That comment really resonates with me when I'm there on campus, and I try and sit in. We have our faculty that are permanently there on campus, We have 15 physicians. They're now being licensed by the Dominican government. So, we have MD, PhD neurologists, internal medicine docs, you name it, neonatal care specialists. But in terms of the physicians that fly in, many from Yale, Wisconsin, Penn State. We had a nephrologist just in from MD Anderson. But commonly Dr. King, who's a colorectal surgeon up at University of Wisconsin, and he comes down to teach about 6 different months of the year. He's on campus. And I love sitting in on those student experiences, and he's showing his surgery videos. And there's the real world of, you look at the textbook, they don't show you the layers of fat in the abdomen as he's going through and executing his surgery and teaching students about the different navigational aids, I guess, as he's completing his surgeries. And it doesn't look like it does in the textbook. And there's real world challenges there. And I see him challenging our students and saying, all right, we can remove, whatever it is that needs to be removed in that type of surgery, but what's the consequence of that? What can we rebuild? What can we redirect? Is there anything else, and so it's real world experiences. We're not going to pay our physicians to read slides to our students. They're going to be sitting there and helping them work right through these cases, whether that's looking at CT images, x-rays, surgery videos, whether that's, going with you, Dr. Wiley, and out into the communities. This is where the curriculum really comes alive. Our students have to know this in context. And I do have to say that, the National Board of Medical Examiners, I think Dr. White can expand on that, but they've totally changed the way that they test for step 1, which, our students are required to pass U.S. licensing exams. If they're going to apply to the Canadian match, they'll take their Canadian exams as well. And but the NBME does not test, in these transactional type questions. They're all clinical. You're getting clinical data. You're being asked to answer those. But we actually only use NBME questions for all of our exams on campus. And so I think we'll get that question from parents and prospective students. How do I know that my son or daughter, or how do I know that I'll do well on the USMLE halfway through? We don't use gating exams. If our students pass our classes, they're entitled to go and take step 1. And with the reason that we know that they're prepared is they're taking NBME classes the whole way through, or tests the whole way through. So you can't get through any one of our modules without having an exam written by the examiners themselves, by the National Board of Medical Examiners. And we've only had, I think, one module, the very first one that any students have had to repeat so far. That's Foundations of Medicine, with much of the biochemistry and genetics background in it, a 7-week module that starts our program. It's actually also part of our prep program as well. So students in prep are getting extra background in that. But Dr. White, do you want to talk a little bit about some of that outside review in terms of NBME, and then we'll open up the floor again to questions.
Sure, Kerry. As you pointed out, many medical schools rely on faculty authored questions, both for their formative assessments, but also their summative assessments. And that type of system is open to a number of challenges in terms of quality control of the questions, the construction of the questions, the difficulty level of the questions. So we took the decision to move to the NBME so-called customized assessment service, which allows the faculty who are teaching to select questions from what is a very large database of questions that have been used on the USMLE Step 1. So all of the people writing the questions for NBME also write Step 1. And we spend a lot of time within the modules preparing students and helping them adjust to the way in which NBME questions are written, the sort of language that is used. And a feature is that we have a formalized practice exam in each module about a week in advance of the final module assessment. And that practice exam is constructed to represent what the students are going to see in the final exam as well. And that rolls on continuously through both years in the basic sciences. And in semester 4, we'll be running an extensive board prep course, also specifically aimed at helping students prepare for their step one and their success at step one.
That's great. I think our curriculum is, preparing people every day, and it's great. We'll have that course there at the end as well. Maria, do we have any questions that have come in regarding our community involvement in Dominica?
It looks like we have answered all the questions. If there are any remaining questions, please feel free to drop them in the comments section. This is a wonderful opportunity to interact with the president, the dean, the director of the community program as well. So, you're not going to get too many better people to answer these types of questions. So please feel comfortable. Feel free to drop them in the comments section. I know we have given you amazing information so far, so there may not be any further questions.
Let me ask one of Dr. Wiley then. Dr. Wiley, how do you see your program evolving here in, say, the next 1 year, or where even 5 years you'd like us to be in terms of our community medicine involvement?
So, one of the things that we're really trying to look at is how we can support, sustainable community health programs on the island. So, for the community medicine course that will be starting in January, so that'll be for like the year 2 students, we are looking at actually having research and community projects embedded within that course. So our students will also get an opportunity to do community-based research, to do that clinical practice in the community, look at ways that we can actually use that local research to inform improvements in health policy, health structure. I mean, one of the things we see in Dominica is there's a lot of challenges around a number of health professionals on the island. There is a health human resource shortage, as there is across the world. But there's been some significant investments in the community. So when you come to the island, you'll see there's brand new health centers all over the place, and maybe not enough people to work at them. So it'd be a great opportunity for our students to be able to start working in those community health centers in partnership with local community members to advance, some of that health systems improvement on the island. As I said, like research, as a researcher myself, I want to see students more involved in research and looking at how can we improve health services, particularly around the prevention. So we see higher rates of cancer. One of our researchers, one of our faculty who's not a medical doctor but has a PhD, she does genetics research in cancer and oncology. And that's something that she would like to see as a project she could support here on the island, and looking at what are some of the genetic markers for cancer that we see in Dominica, so we can help prevent cancer, particularly those early cancers that we're seeing happen on the island. So those types of things I get excited about. We also have these long-term partnerships. So when our students are able to work in the clinical settings, we want to see more opportunities for them to get that clinical research experience of what are some of the best practices in clinical medicine that they can do. I know we have a number of neuroscience experts on our team, and I think we have some students who are very interested in that. So maybe we can offer some of those, specialized research in clinical care aligned, in the sort of medium to long term.
And I know there's a number of things that the Ministry of Health has reached out to the university about, including really the number of strokes that are happening in Dominica, 3 to 5 a week, which for a population of 70,000 is quite a lot. And I think much of your work in terms of prevention. I know you're screening for diabetes, for hypertension, of all the I guess the factors that are leading up to stroke later in life. I think that's certainly a place that our students and faculty can make an impact.
So it looks like we just have a question that came in. How far across the island do the students travel to be able to reach these communities?
Carrie's probably more familiar with the topography of the island, but it's a tiny island, right? So if the roads were straight, you could probably be an hour from one end to the other. It's not very far. Yeah. I know it's about an hour and a half drive to the Kalinago community, because they are on the opposite side of the island. Grand Bay was another area where there's a lot of youth projects that the president would be interested in us engaging with, like the president of Dominica, around, youth mental health issues and youth engagement. So that's about an hour and a half. I don't think anywhere is more than an hour and a half away from anywhere else on the island. It's a very small island. The community projects that we were doing, like everybody comes to the market in Portsmouth in the morning, so that's only like 15-minute drive from the campus. So there's and communities are all over the place. So I know Dr. White talked about the 365 rivers. The rivers divide one town to the next, so it doesn't take long to get to the next town. Everything's quite close.
Yeah. You must have hit traffic. It usually takes me 5 minutes to get to Portsmouth, but but no, it's so yeah. A lot of the work we do is in the northern part of the island right now. Portsmouth, our immediate surrounding area. But there's a new hospital that was built over in the northeast part of the island in Marigot. There's an existing 300-bed teaching hospital in Roseau, which is about a 45-minute or 50-minute drive. And then in terms of the different communities, like Dr. Wiley said, it's really the farthest community is about an hour and a half, hour and 45-minute drive. So, these are all-day engagements. If it's something local to Portsmouth, it might be a half a day that our students are engaging at one of the health fairs. But if you're going to other parts of the island, it's certainly a full day. There's about 3,000 people within the Kalinago community. It's really the last Kalinago community of any size in the Caribbean, and so it's really just such a unique part of being in Dominica and part of what we're doing here in terms of our community involvement. I think ahead to when students are applying for residency, they've had this experience with our curriculum and this physician-led education on campus, 2 years of clinical training in the United States. But when you go to the interview, it's not just about what happened on campus or within the confines of that hospital, but I think our students have an opportunity to talk about the research that they've done or the involvement, the impact that they understand that they make as a physician, to people's lifestyles, not just when they're sick and in their office. So I think it's setting our students up for being great physicians, but also having something that they can be proud about when they're getting ready to graduate and when they're looking at next steps for their postgraduate training.
And just to build on what Mr. James was saying, that what I see happening in Canada too is, we have very high level people with great background in biochemistry and all of the clinical experiences. But what we're really looking for now in residency recruitments is people that have that community engaged experience, that commitment to equity and understanding of how to address the social determinants of health, and some experience in the field of, as I said, with the complexity of real life, and bringing some of that humility to their work, knowing that we learn as much from our patients as we have from school and how we can do good clinical care. So the experiences that we're offering through the community engaged learning is really going to give you an edge in the residency placement applications as well.
Great. Well, Chelsea says, thank you so much for yet another informative webinar. And I wanted to echo that sentiment. I guess President James, Dr. Wiley, Dr. White for joining us today and answering and giving us so much information about the involvement in the community medicine program that we have, outreach in Dominica. So Afshin says, can't appreciate enough all the great info and insights shared and presented by everyone on the panel. So there you go. So you're welcome. It's our pleasure. Again, we are here to assist and help in any way we can. Here is the QR code. So if you feel that we are a right fit, or if you have questions to determine that, please reach out to me, or take your phone and take down the QR code and fill out the application this evening, whether it's to our MD program or our Prep for Success program. Send me a text as soon as you do it. Let me know. Say, Maria, I went ahead and applied, so I can go ahead and congratulate you. But once again, thank you to the three guests. I hope everybody has a lovely evening. And I wish all of our guests around the world a lovely evening as well. Thank you.
Thank you.
Thanks, everyone.
You.